A vaccine is showing positive results in fighting RSV, an infectious disease that leads to the death of thousands of babies.
The man behind it works at the University of Texas at Austin. KXAN's Alex Capriello spoke to the scientist who unveiled this groundbreaking work for the very first time.
For mom Veronica Sedeno, there's nothing worse than a sick kid.
There's lots of sicknesses out there.
Some worse than others.
Have a healthy kid one day and then have to be in hospital with almost fatal disease.
One UT professor is looking to save parents from that heartache.
Worldwide, it might lead to up to 100,000 deaths globally each year.
Jason McClellan has developed a vaccine to fight respiratory syncytial virus, better known as RSV. It's one of the top killers of babies and also targets the elderly.
Being able to try and create a vaccine for something that infects everybody, especially our most vulnerable, the weakest and the oldest, it's exciting to work on that.
Other scientists have tried and failed, but McClellan brainstormed a new way to create the vaccine. This version creates thousands of antibodies, which fight off the virus for months at a time. Take a look at these 3D models. Previous versions of the RSV vaccine turned the virus's proteins into this form, which prevented the vaccine from being effective. McClellan's version keeps the proteins in their original shape. McClellan says this approach can be used to fight other infectious diseases. Sedeno says if it helps even one kid stay healthy, it'll be worth it.
It's always good to just keep the science going forward and hopefully producing the vaccine that everyone could have so that we don't have any problems.
Alex Capriello, KXAN News.
And there is a long way to go before this vaccine is rolled out to the public. McClellan says he hopes distribution begins by 2024.
Most drugs take more than 10 years to make their way to the marketplace. After developing the drug, it goes through preclinical research. Researchers look into whether it could seriously hurt people. If approved, it goes on to human clinical trials. There are 3 phases to this step. Each one has its own timetable. The RSV vaccine is only in phase 1. Every part of the process is then reviewed by the FDA. The agency has 6 to 10 months to decide whether or not to approve the drug.